Hello everyone, and welcome to our presentation about lung cancer. Today we will be talking about the basic topic of cancer, followed by a deeper conversation about lung cancer that include who can be affected, symptoms, different types of lung cancer, stages of disease, and risk factors. After researching this topic for a while, we came across a thesis that we formulated, and that is non-smokers will have a higher probability of surviving lung cancer compared to smokers. To get started, what is cancer? Cancer is a disease where cells in the body grow out of control at an exponential rate. When it spreads towards the lungs, it's classified as lung cancer. Lung cancer is the uncontrolled growth of abnormal cells that start off in one or both lungs, which is normally in the cell that line our passages. These abnormal cells don't develop into healthy lung tissue. They rapidly divide and eventually form tumors. It spreads to many organs, commonly in the lymph nodes. Lung cancer is usually graphed into two main cell types, small cell and non-small cell. Most people affected by lung cancer are 65 or older. There is a small amount of the human population that is diagnosed under 45, which is quite rare. The average age of a diagnosis is just around 70 years old. Each year, the disease kills more people than colon, breast, and prostate cancer combined. We found this visual from the Congressionally Directed Medical Research Program's website. Just to become a little bit more aware of how serious lung cancer is, 1.6 million people are affected worldwide, and 427 Americans will die of lung cancer each day. That's not even including the number of deaths outside of the United States. And just a few statistics about lung cancer. An estimated 234,000 adults just in the United States will be diagnosed with lung cancer in 2018. It's the second most common cancer and leading cause of death for men and women. It's predicted that over 154,000 people will die from lung cancer. A few more graphics we found during our research. A bar graph explaining 5-year survival rates by each stage and category. The main idea of this image is the earlier you catch the cancer, the more likely you are to survive. Another visual representation, you can see how many more people are affected each year by lung cancer compared to prostate, breast, and colon cancer. Lung cancer on the average affects about 40,000 more people than those other well-known cancers. Like we mentioned earlier, the earlier you catch the cancer, the more likely you are to survive. So if you believe you are ever at risk, you should look for symptoms. Like we mentioned earlier, lung cancer is graphed into two different types. They're called small cell lung cancer and non-small cell lung cancer. They both grow differently and are treated differently. The names refer to what the cancer cell looks like under a microscope. Small cell lung cancer accounts for approximately 15% of lung cancer. It grows at an alarming rate, yet does respond well to chemo. It normally begins in the large airways of the lungs and spreads early, often to the brain. Non-small cell lung cancer is diagnosed a lot more often than small cell lung cancer. Non-small cell accounts for 85% of lung cancer diagnosis. Non-small cell is divided into adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. These are basically a more in-depth analysis of what kind of non-small cell lung cancers you may have. In a deeper analysis of the subdivisions, the adenocarcinoma diagnosed within 40% of all lung cancers. This type of lung cancer occurs mainly in current or former smokers, yet is also the most common for non-smokers, and it's more common for women than men. Adenocarcinoma is usually found in the outer parts of the lung, though it's said to grow at a relatively slow pace. It's different for every patient. Squamous cell carcinoma accounts for 25% to 30% of all lung cancer. This cancer starts early in flat squamous cell that line made in the airway of lungs. This type of cancer also has a history line to smoking.
And finally, there is large cell carcinoma. It accounts for 10 to 15% of all lung cancers and can appear at any part of the lung. It grows faster than other cancers, which makes it all the more difficult to treat. For lung cancer, there are 6 stages to identify how serious the cancer is and how far it is spread. Stage 1, Stage 2, 3, 3A, 3B, and 4. Stage 1 lung cancer is the earliest stage of the cancer. It also has the highest rate of survival throughout all the stages. Treatments for Stage 1 include surgery, chemotherapy, and radiation therapy. Stage 2 lung cancer is known as a localized cancer. That means a tumor is present in the lungs and possibly spread to the lymph nodes, but not any further. Just about 30% of people diagnosed with stage 2 live past 5 years after the diagnosis. Surgery, like a lobectomy or sleeve restriction, is an option for treatment. Stage 3 has two subdivisions, 3A and 3B. Stage 3 basically means the cancer is spread through the whole middle of the chest, lungs, and lymph nodes. A few treatments include targeted therapy, immunotherapy, etc. In stage 3A, cancer is found in the lymph nodes, but only on the same side of the chest where it started, so it hasn't moved horizontally. Treatments include combination therapy, radiation therapy, etc. Yet these all vary based on its position in the chest. And in stage 3B, the cancer has spread to the other side of the chest and into the lymph nodes, above the collarbone. A combination of chemo and radiation is recommended. And then stage 4. In stage 4, the cancer has spread into both lungs, and even possibly neighboring organs. About 40% of non-small cell patients are diagnosed with stage 4 lung cancer. While in stage 4, chemotherapy is highly recommended. The survival rate for stage 4 is only 4%. If you've had a family history of lung cancer, it's recommended to get screened here and there. Scanning is testing for a disease when there are no symptoms. It's nothing but a low-dose CT scan. Those who should be scanned include between the ages of 50 and 85, and those who have smoked for more than 15 years. Since lung cancer is one of the most dangerous diseases out there, you really want to know what can cause it to stay precautious. You want to watch out for breathing in hazardous substances. Another type of lung cancer is called mesothelioma. Mesothelioma is caused by a long exposure to asbestos, so you want to stay precautious if you're ever around arsenic, cadmium, chromium, nickel, etc. Yet the biggest risk factor for lung cancer is definitely smoking. Tobacco smoke is a toxic mixture of more than 7,000 chemicals, and at least 70 of those are known to cause cancer. Even though it's literally 1/100%, it still causes cancer. There have also been studies about vaping causing cancer as well. Because we are the first generation to experience vaping, we won't know the consequences for a few decades. With smoking being the biggest risk factor for lung cancer, people who smoke are 15 to 30 times more likely to get lung cancer. Yet if you quit, your risk lowers, but still have a higher risk than someone who hasn't smoked before. Some may ask, what is actually happening to my body when I smoke? How does it actually make my risk higher for lung cancer? Well, smoking causes damage to cells that are in your lungs. When you inhale smoke, you're inhaling substances and chemicals that damage you. It damages your cardiovascular system and restricts blood flow. There are also physical changes like skin tone change. And smoking doesn't just affect you in your lungs. It can also affect you in several spots of your upper body. Your mouth, throat, esophagus, stomach, colon, rectum, liver, pancreas, trachea, kidney, and several other organs are at risk when you smoke. And secondhand smoke can also have an effect on your health. In the U.S., 2 out of 5 adults who don't smoke are exposed to secondhand smoke, and over 7,000 people who never smoked have died due to secondhand smoke every year. This image is from the American Cancer Association, and as you can see, smoking really has a huge effect on your lungs. On the left you see a normal human lung not exposed to smoke, and on the right you see the lung of a smoker. All of the chemicals and substances have been built up and now reach its way to the lungs. With lungs like these exposed to smoke, it can cause shortness of breath, a weaker immune system, and could possibly lead to cancer. Just to summarize this presentation, 1 in 16 people in the U.S. will be diagnosed with lung cancer in their lifetime. More than 234,000 people in the U.S. will be diagnosed with lung cancer this year, with a new diagnosis every 2.2 minutes. It's the leading cause of death for both men and women. The earlier you catch the cancer, or earlier stage you find it, and you're able to treat it, the more of a chance you have to survive. If you're over the age of 40, you may want to look into being screened just to be precautious. There are a few risk factors for lung cancer, yet smoking is the leading cause. People who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from lung cancer than people who don't smoke. Even smoking cigarettes a few times a day or smoking occasionally increases your risk of lung cancer. You don't have to be a huge heavy smoker to be diagnosed with lung cancer from the smoke. To conclude, smoking is the biggest cause of lung cancer. And to return to our thesis, non-smokers in fact do have a higher probability of surviving lung cancer than people who do smoke.